Cancer is a pretty scary word, but the good news is that some types of cancer can be treated really well, especially if they're caught early. But if you ignore the signs, it could seriously have life-altering consequences. Like it could really mess up your life. Sometimes, the signs of cancer that you should look out for are things that you might just brush off or think are caused by something else. You're busy living your life, so you might not even realize how serious these signs could be and just ignore them. But if you pay attention to your body and know some of the sneaky signs of cancer, it could actually save your life. Number 1. Unexplained weight loss. Losing weight without knowing why is actually a common sign of cancer, but a lot of people don't even notice it. If you've recently dropped a few pounds for no clear reason, it's definitely worth paying attention to. Studies have shown that losing 5 to 10 pounds or more without changing your diet or exercise routine could mean there's an underlying health issue and you should see a doctor. Losing weight unintentionally is often one of the first signs that something might be wrong with your health. As cancer cells grow and spread, your body has to work harder to function properly. This extra effort actually burns more calories, even when you're just resting. Some cancers might even release chemicals that speed up your metabolism or make you less hungry. If you're finding this video useful, subscribe to this channel. According to the American Cancer Society, losing weight without knowing why is a major symptom of different types of cancer, like pancreatic, stomach, esophageal, and lung cancer. In fact, it's estimated that 40% of cancer patients experience weight loss when they're diagnosed. If you're losing weight without a clear reason, it's really important to see a doctor for an evaluation. Finding cancer early on is key to successful treatment and recovery. Number 2. Unusual lumps or swelling. If you notice any weird lumps or swelling in your body, it could be a sign of cancer. Cancerous tumors are just a bunch of cells that go crazy and grow like crazy. If you see any noticeable lumps, bumps, or swelling, it could mean you got cancerous tumors. If you got any lumps or bumps that don't hurt and won't go away, it could be an early sign of cancer. Enlarged lymph nodes can be a sign of cancer, and about 20% of lymphomas are first found this way. If you got swelling that won't go away in certain parts of your body, it could be a sign of different types of cancer. If your belly is swollen, it could be a symptom of colon cancer. Swollen lymph nodes in your neck could mean you've got lymphoma. Besides weird lumps and swelling, you should also watch out for other signs of cancer. If you got constant indigestion, it could mean you've got esophageal or stomach cancer. If you're having trouble swallowing, it could be a symptom of esophageal or stomach cancer. Seeing blood in your pee could be a symptom of bladder, kidney, colon, or other types of cancer. Number 3. Changes in bowel habits. Changes in bowel habits that are unusual for you can be a sign of cancer. Like if your bathroom routine suddenly changes. If you experience persistent diarrhea or lose stools for more than a couple of weeks, it may be a symptom of colon or other gastrointestinal cancers. So, if you're spending a lot of time on the toilet, it might be worth looking into. According to recent studies, individuals with prolonged episodes of diarrhea face an increased risk of developing colorectal cancer. So don't just shrug it off as a bad burrito. If your stools start looking very thin like a pencil over time, it might suggest a tumor developing in the lower colon or rectum. Yeah, I know it's weird to talk about, but it's important to know. Seeing blood in your stool, whether it's bright red or very dark, is a significant symptom that could indicate colon or rectal cancer. I know it's gross, but it's something to watch out for. Statistical data reveals that nearly 1 in 24 people in the United States is likely to develop colorectal cancer during their lifetime. It's actually more common than you might think. Ignoring alterations in your normal bowel habits is not advisable. If you are 50 or have a family history of colorectal cancer, it becomes even more critical to address these changes promptly. Yeah, age and genetics can play a role, so be extra vigilant. While these symptoms may have non-cancerous causes, seeking a proper diagnosis is essential for appropriate treatment. It's always better to be safe than sorry, right? Your bowel health, and ultimately, your life could depend on timely medical attention. Yeah, it's that serious. Number 4. Persistent cough or hoarseness. A persistent cough that just won't go away can be one of the first signs of lung cancer or throat cancer. Yeah, a cough that sticks around can be a warning sign. If you've had a cough for more than a few weeks, it's worth getting checked out by your doctor. Don't wait too long to get it checked out, just in case. A cough that won't quit can be caused by a postnasal drip, acid reflux, asthma, or bronchitis. But it could also be something more serious, so it's better to be safe than sorry. But in some cases, it may be a symptom of a tumor in the lungs, throat, or larynx. I know it's scary to think about, but it's important to be aware. Lung cancer in particular often has no early symptoms, so a stubborn cough could be the first red flag. Yeah, lung cancer can be sneaky, so don't ignore that cough. Surprisingly, up to 25% of lung cancer patients experience a chronic cough as one of their initial symptoms, according to research published in the Journal of Thoracic Oncology. Yeah, a cough can actually be a big clue. Hoarseness, or a raspy, muffled voice that persists for more than a couple of weeks, can also be a symptom of throat or laryngeal cancer. So if you sound like a frog for more than a little while, get it checked out. The American Cancer Society estimates that approximately 13,000 new cases of laryngeal cancer are diagnosed annually in the United States alone. Yet, it's more common than you might think. Number 5. Unexplained fatigue and weakness. Feeling constantly tired and weak may be an early sign of cancer. Even when a tumor is too small to detect, cancer cells can deplete your body's energy and resources. If you're grappling with persistent fatigue and weakness that isn't linked to physical activity or lack of sleep, it could signal a more serious issue. Studies, like the one featured in the Journal of Clinical Oncology, reveal that fatigue is a common symptom, impacting up to 75% of cancer patients during treatment. A noticeable decrease in strength or stamina is often observed, making tasks that were once effortless now feel challenging. Simple activities such as climbing stairs, carrying objects, or walking longer distances can become daunting. Changes in appetite are also potential markers of cancer, leading to shifts in metabolism and eating habits. You might experience a loss of appetite or develop cravings for specific foods. Any alteration in your typical eating patterns is essential to recognize. Other possible symptoms to watch for include losing weight without dieting or increased activity, excessive sweating during sleep, difficulty breathing or pain in the chest, especially when lying down, and frequent or severe headaches. Number 6. Changes in mouth. Changes in your mouth might be a sign that something is not quite right. Keep an eye out for anything unusual like lumps, sores, or patches that don't go away after 2 weeks. These could be signs of oral cancer. Loose teeth without a clear reason could mean there's a problem, possibly with your gums or even cancer. If you're having trouble swallowing and it hurts or feels like something is stuck, it's essential to see a doctor. It might be a sign of mouth or throat cancer. If your voice changes and stays that way for more than 2 weeks, or if you start speaking oddly, it's a good idea to check with your doctor. Chronic bad breath that doesn't go away even with good oral care might be a sign of an issue like gum disease or, in some cases, oral cancer. Jaw pain that sticks around, especially if it's only on one side, could be a sign of oral cancer too. Always get it checked out by a dentist or doctor to be sure. Number 7. Anemia. Anemia is a condition in which your blood lacks enough healthy red blood cells or hemoglobin. Hemoglobin is the main protein in red blood cells that carries oxygen throughout your body. According to a study published in the Journal of the National Cancer Institute, anemia is associated with an increased risk of colorectal cancer. The study found that individuals with anemia had a higher likelihood of developing colorectal cancer compared to those without anemia. The most common cause of anemia is low iron levels. Your body needs iron to make hemoglobin. If you have low iron levels, you may not have enough hemoglobin to carry oxygen in your red blood cells. Signs of low iron anemia include fatigue and low energy, shortness of breath, chest pain, pale skin, and cold hands and feet. The good news is anemia caused by low iron is typically easy to treat. Eating more iron-rich foods, taking an iron supplement, and improving the absorption of iron in your diet can correct your anemia. However, anemia can sometimes be a clue to a more serious underlying condition. So if your symptoms do not improve with iron treatment, or you have other signs of colon or stomach cancer, talk to your doctor. Number 8. Night sweats. Night sweats can be one of the first signs of cancer that people often miss. If you're waking up in the middle of the night soaking wet and it's not due to the temperature in your room or drinking alcohol before bed, it could indicate a medical issue like cancer. Some possible cancers linked to night sweats include lymphoma, leukemia, and Hodgkin's disease. While night sweats can have other causes like hormonal changes, it's best to be safe and talk to your doctor if they become an ongoing problem. Getting the right diagnosis and treatment quickly can make a life-saving difference. Don't be afraid to speak up about this symptom, as it's not something to sweat about in silence. If you enjoyed this video, click on the next video and press the like and subscribe button below.